All right, welcome back. This video explains what implant disease is. It's also called peri-implantitis. This is a disease that essentially occurs around implants. And in general, the dental implants have a success rate of 95%. While they are being maintained properly over time, they succeed to be in place for a lifetime if the proper oral hygiene is used and recommended and performed by both the patient as well as in the office. So, gum disease around implants or implant disease is really a multifactorial disease, but the main reason it occurs is through improper oral hygiene and growth of bacteria around the implant and the gum tissue, which then migrates to the bone and leads to bone loss around the implant. And these bacteria live in the pockets for an extended period of time. And if the patient is not cleaning very, very well and is not receiving a cleaning, professional cleaning every 3 months, then there is a likelihood that bacteria and dangerous bacteria will grow in the site, which then will lead to progressive inflammation and progressive bone loss. The issue with implant disease is that most times it's not painful. So patients don't feel it necessarily. And because of that, it comes almost as a surprise when they come after an extended period of time to the dental office, only to realize that their implants are losing bone. To show you here a little bit more clearly, plaque and inflammation is what really causes bone loss and inflammation around dental implants. And this can clinically look as puffy gums, bleeding gums, but also sometimes pus coming out of the pockets around dental implants. We know in the research that there are some components that lead to more exacerbation of gum disease around implants. One of them is smoking or vaping. Both of them can lead to gum disease around implants, can prevent implants from healing in the bone. And even if the implants have healed in the bone, it prevents them from reaching their maximum potential of staying in the mouth for as long as possible. The other main component of possible failure of dental implants is diabetes or high blood sugars in general. So, patients, even if they're not diabetics, but they have an extensive increase of their blood sugars throughout the day, throughout the weeks and months, can lead to an improper response of the soft and hard tissue around implants, which then would lead to possibly implant instability and possible failure. The last really main reason why implants fail over time is the response of the body to the dental implant. At times, we have an exacerbated inflammatory response through systemic inflammation in the body that also impacts on the bone metabolism or the bone growth or the bone stability around dental implants. So we have a healthy patient otherwise who is not a smoker, does not have diabetes or high blood sugars, but yet still has bone loss, but they happen to have some form of osteopenia or osteoporosis or some form of mild or moderate systemic inflammation in the body that could lead to bone loss around dental implants. So, in general, we like to see that when dental implants integrate in the bone level has to be all the way to the neck of the implant, which means that the bone is healthy and the gum tissue above the bone is also healthy and doesn't have inflammation. This is how it looks like on a regular x ray, which means that as you see, the bone is right at the neck of the implant. And this x ray shows that we have adequate amount of bone around the implant and the implant seems to be stable. When dental implants lose bone around them, the bone can be lost in multiple directions in very particular ways, and that can, in the mouth, feels like inflammation around the implant, some bleeding, possibly pus coming out, some puffiness in the area, and some sensitivity while brushing. On the X-ray, this looks like bone loss around the implant that's fairly visible. And depending on how much bone loss there is, we will classify the case as slight or moderate or severe or hopeless dental implant. And this is all called peri-implantitis. But again, remember that this condition develops if the patient cannot control for plaque and inflammation and bacteria around their dental implants because they have not been extremely consistent with the proper oral hygiene, but also have not been utilizing the professional hygiene measures that usually should take place every 3 months from the time the implant is loaded with a crown. The patient has to come back every 3 months for a professional cleaning, but they also have to, at home, follow the proper instructions of using water pick, using a tooth floss, as well as brushing in the area. So, how to treat implant disease when we see it? The very first thing we need to do is to really classify the implant disease and the extent of it. So in this diagram, you could see that on the very far left, the implant has bone all the way to the neck and it's healthy. And then as you progress to the right, we start by having perimucositis, which is an inflammation of the gum tissue, but the bone is still healthy. And then peri-implantitis that goes into moderate, early first, moderate, and severe or advanced. And the deeper this inflammation goes, the less likelihood of success that implant will have even after therapy, even after corrective therapy or revision therapy or surgery. There is a very good likelihood that the implant will still have some form of ailment or complication down the road. The main treatment really for dental implants when they fail is to remove the plaque and bacteria and inflammation around the threads of the implant, around the gum tissue, as well as the bone. That we use multiple procedures. Some of them are actually closed procedures, meaning that we don't have to open the gum tissue in order to clean around the implants. And these are usually reserved to early stages of gum disease around implants. As you see here, we go all the way to the depth of the defect and we clean the implant all around so that we can remove the inflammation and remove the bacteria in the area so that the implant can survive for longer period of time. At times, the defect or the inflammation is so advanced that we have to open the gum tissue surgically and clean openly around the implant. And at times, as you see in this picture, when we have a defect or a somewhat of a circumferential hole around the implant, sometimes grafting would be necessary. But the main goal of therapy is really to eradicate the bacteria that lives close to the implant, lives in the pocket, and lives in the bone around the implant, and to provide a clean environment for the implant disease not to progress any further. One question I get asked very often is, can you regenerate the bone? Can you bring the bone back from the red line that you see on the right side to the left line, which is supposed to be the healthy line where the bone should have been if the implant did not develop disease? And the answer to that is that it depends on the case. If the defect or the bone loss is has a horizontal topography, meaning that there isn't a hole around the implant that could be grafted, then this bone cannot be regenerated. The purpose of therapy is really to clean the implant from the bacteria and the inflammation, and then to close the gum tissue around the implant that now has been cleaned and to remain in that situation over time. That situation on the upper hand side of the picture, as you see, cannot be regenerated. And the positive aspect of this is that now the implant is cleaner, so the environment has less inflammation, so the disease progresses much slower. The downside of this therapy is that, as you can see on the picture on the right hand side, the crown now, the neck of the crown seems to have a distance from the gum tissue, which is not very, very aesthetic because patients sometimes complain that there is food getting stuck in the area, as well as when it's in the aesthetic zone in the front aspect of the mouth, the patients may develop a black triangle, which essentially is a void. It's a space between the crown and the implant. This complication, that is an aesthetic complication, cannot be corrected because the neck of the implant is now exposed, even though it's healthier, but it's exposed to the outside, which means that the patient has little space that they sometimes complain is not very aesthetic, or they complain that it's food gets stuck, which means that they require much more cleaning for them to keep this area clean. Let's look on the lower aspect of this slide, where as you see, there is a somewhat of a defect around the implant. And in this case, the goal of therapy is not just to clean the implant, but also to graft that defect. That defect is called graftable defect, which means that after we clean the implant, there is a possibility that we can place additional bone in the area and then close it and allow the body to heal and allow that bone to become yours. And again, in this case, we can regenerate some of the bone, not all of it. But the downside, again, is that as you see on this picture, the crown remains at a distance from the gum tissue, which means that it's not extremely aesthetic because there is a space that develops, but also requires much more cleaning down the road because food gets stuck in the area. But these are not exactly the 100% solutions to dental implant disease, but they certainly have the advantage of making sure that the implant remains as healthy as possible over time. Now, what to expect after therapy? I want to speak to you about once you receive this therapy, the likelihood of success is fair. It's not necessarily excellent. You may still develop gum disease around the implant down the road, especially if you're not cleaning very well. So we always insist that you use water pick around the dental implants mixed with hydrogen peroxide so that the bacteria is being killed daily through the use of hydrogen peroxide and bacteria. I always recommend half a cup to a cup of 3% hydrogen peroxide in the family size water pick. The water pick family size, the big size, should be filled daily with warm water, and then half a cup to a cup of hydrogen peroxide 3% should be placed in the water so that that antimicrobial effect will essentially dislodge and kill the bacteria in the area so the implant remains healthy over time. Also, remember that flossing is very important because it's a mechanical dislodgement of the bacteria around the implant, and every 3 months you have to come back for a professional cleaning around the implant to make sure that anything that gets stuck or anything that promotes inflammation gets dislodged professionally every 3 months by the dental professional. I hope this video helps you understand what implant disease is, what the therapy about implant disease is, and also how we fix it and what to expect after the therapy. Thank you and take care.